To all. Okay, this is your Professor Dr. Cabrera. Okay. I'll be teaching you online on pediatrics. The topic is social and ethical issues in pediatrics. Okay. So, what are the social issues that you can encounter in pediatrics? The social issues are adoption, foster care, separation and death, the impact of violence on children, and abuse and neglect in children. So I have a number of videos that was taken in YouTube, and I hope they will not be getting the copyright for it. So let's start with adoption. So the definition of adoption is a social, emotional, and legal process that creates a family for children when the birth family is unable or unwilling to parent. So, one-third of all adoption handled by private agencies or independent practitioners. There's quite a challenge if the child has special needs. Okay. And there are instances that children are adopted from overseas, especially in war-torn countries, because they suffer from poverty, social hardship, and war. So, in adoption, what is the role of a pediatrician? A pediatrician can help prospective adoptive parents by evaluating the health and developmental history of the child. Okay, if ever, there will be information from the birth families as to assess actual and potential risks that children may have. The pediatrician can promote positive adjustment of the child and family by providing guidance and support at all stages of adoption. Well, most adopted children and families adjust well and lead healthy, productive lives. Okay, so it's not in okay, unlike in the movies. Okay. And then we proceed to foster care. So what is foster care? These are usually foster care is developed as a temporary measure to assist families in crisis, like in the one that we had in Taal. Okay, so less than 5-year-old children enter foster care for not only in crisis but also the placement of a abused child and neglected child, which can be secondary to or those children of parents who are having substance addiction, or children exposed to spousal abuse of one of their parent, or children who are exposed to inadequate housing or homelessness, and children of parents who lack parenting skills, or even parents that has mental or physical health problems, or those who are in jail or incarcerated. Children that goes into foster care. Okay, child care. Okay, these are care provided by individual outside the nuclear family or in a setting separate from the child's home. Example, child care is babysitting. Or the child care example would be daycare center, or preschool, or nursery schools. Those are all centers for child care. And those some areas who has early childhood programs. Okay, and we'll go to the next. The third would be your separation and death. Okay, so it's noteworthy to understand the reaction of children to separation, like divorce or even placement in a foster care. Brief separations like this, like vacations, will have minor transient effects. The more enduring ones are those with frequent separations, and they can manifest with significant sequelae. Like young children, they usually will cry. They either will present with tantrum like crying, they protest or become quieter, sadder type. Then they usually will be subdued and withdrawn. Some, however, can be irritable, fussy, moody, resistant to authority, go out to the neighborhood looking for the parent, or even leave home. Okay. School children may respond with depression, indifferent, or be markedly angry. Older children and adolescents show more intense anger. Migrant children and families, okay, with this one, they need to adjust to new community, new school, house, new culture, and in many cases to a new language. Well, the death of a parent is a type of ultimate separation, and that is usually perceived as reversible for those children less than 5 years old, with their belief that the dead will be coming back to life and will become ghost. For the older children at 8 to 9 years old, they personify death as the Grim Reaper who punishes and avenges. But older children understand death as a process. It's a universal and final biologic process. Well, that's we're talking about that, and on the next slide would be the video regarding child abuse.
ABS-CBN ang ginagawa ng yayang si Bernadette Casuco alias Badet sa alaga niyang baby na 3 months old pa lamang noon. Nakuna ng CCTV kung paano hambalusin at alugin ng yaya ang kawawang baby. Ang nakako na makikitang sinasampal ng yaya ang baby. Aakalain mo ring naka-fast forward ang video na ito sa bilis ng pagyugyog sa bata. Pero kung titignan ang timer, normal naman ang takbo nito.
I sat down and I reviewed 2,000 hours of footage. And what I found was masama talaga, more than 100 acts of child abuse nakita ko. It's very
The impact of violence in children. Domestic violence is the source of the first exposure. And 15% of children are victims of domestic violence, and most of their injuries occur when they intervene to protect their mother from their partner. So what is the impact of violence in children? Okay, though we make the screen to be a nanny for our children. Okay, so TV is the most ubiquitous source of exposure to violence. An average child around 2 to 5 years old watches 20 to 30 hours of television a week. And what do they watch? What's the quality of the movies that they watch? They watch gruesome, they watch violent cartoons like the one Oggy and the Cockroach, like Tom and Jerry, okay? Like in cartoons that usually one will hurt the other, but the one that is hurt will die but then lives again. So those are examples of violence. So what are the effects of TV viewing? Because children are exposed to animated violence, they can have increased aggressive behavior, and they accept violence as a way of life. And because of their exposure, they can obscure fantasy and reality, okay? And increases passivity and obesity because of the lack of exercise and their frequent eating in front of the television. And lastly, okay, because this is now a concern in mental health, too much television can increase the risk of suicidal behavior. So be very careful with this. So the violence that children experience and witness has profound impact on the health and development of the child. Violence affects children psychologically and behaviorally, and it may influence how they view the world and their place in it. Children who grow up in violent homes are more likely to be aggressive than their peers. Parents and children, so there's a hope, exposed to violence can be effectively abused and neglected. So this is a case of a 1 year and 6 months old male who was addicted to tobacco.
Program sergap.
It is from Indonesia.
Mulai
It is an old
banyak makan.
Sebulan tuh habis ke 3 meteran.
Sebulan.
Dia kantong hitam itu.
So this video went viral, and because it went viral, authorities were alarmed. So this child has been
Kakek ngomongkan pantai sini wae, pantai lilin wae ngomong dia kan. Pantai lilin, pantai sungai lilin. Itu wae. Lagi. Mana om belum tengok.
It was his father who exposed him to cigarette smoke.
Plastik mana?
Dia tuh tanya makan apa.
So abuse and neglect in children. Child maltreatment encompasses a spectrum of abusive actions, like in that previous video, or acts of commission and lack of action, or acts of omission that result in morbidity of death. Actually, even the photographers have neglected the child, but maybe their intention was to bring the news and bring the case in public. Okay. Maternal drug abuse and failure to seek appropriate health care during pregnancy is a type of abuse and neglect, okay, and because it can have an adverse effect on the child. Okay, so this is the pathways for abuse and neglect. Okay, so abuse is an act of commission, while neglect is an act of omission. They can either be of physical form or psychological form. In either way, they can be abused or they can be neglected. Okay. For the physical, okay, the evidence would show fractures, bruises, burns, and sexual type of abuses. For psychological abuse, okay, they usually are through verbal, they terrorize, they put down, they compare, and they insult the child. For physical neglect, okay, physical neglect means you neglect providing food, the clothing, the proper schooling, medical care, okay, and safety for the child. And the psychological neglect would be you do not give love, you do not give support. You do not recognize the child or not even stimulate the child to learn something new. So this is the flow of abuse and neglect with their physical and psychological effect or component. So physical neglect may result to failure to thrive and to develop and learn. For nutritional neglect, an organic failure to thrive, most common cause of underweight in children, wherein the mother neglects proper feeding, may give inadequate calorie type of food. Mother is preoccupied with the inner problems or is depressed, ignorant about proper feeding, or maybe taking abusive substances, or does not like to understand the infant. Then medical neglect is the failure of a parent to provide appropriate medical care, which may result in worsening of the condition or even death. Psychological maltreatment includes intentional, verbal, or behavioral acts of omissions that results in adverse emotional consequences, spurning, exploiting, or corrupting, holding emotional responsiveness, isolating, or terrorizing. And sexual abuse accounts for major proportions of continued increase in abuse reports. May be perpetrated by a family member, acquaintance, or at least often stranger. Then here's a definition of is a phrase your Munchausen by proxy syndrome, wherein a parent, especially the mother, simulates or causes the disease in the child for her gain. Okay, may fabricate a medical history, cause symptoms by exposing the child to medications or toxin or infectious agent or physical trauma or alter laboratory samples or temperature measurements. That's Munchausen by proxy syndrome. So what are the consequences of this syndrome? The persistence of abuse and emotional problems, and it can cause chronic disability in 8% of cases and can also lead to death. So in 1995, 1 out of 25 children are maltreated. 10% of the injuries in children younger than 5 years are in the ER due to abuse. 15% of children admitted for burns, and 50% of children less than 1 year with fractures are all caused by abuse. So, who are the perpetrators? The father is the number one at 21%, but is equal by the mother, still at 21%. So both parents abuses their children by 21%, the boyfriend of the mother by 9%, the babysitter by 8%, by stepfather by 5% of abuses. So what are the clinical manifestations? For physical abuse suspected when an injury is unexplained, so it doesn't result to what the history tells you. Okay, so these are unexplainable or even implausible. Okay, mostly bruises are the most common manifestation of a child abuse. Most common instrument used is the hand, so sometimes you can see the handprint. 10% of physical abuse are due to cigarette burns, and they can have fractures because of wrenching or pulling of an extremity may result in corner chip fracture or even a bucket handle fracture of the metaphysis. And other fractures may be of the spiral form, which can be due to twisting. Most common form of death in physical abuse is head trauma. Okay, intra-abdominal injury follows, which the second common cause of death in battered children. Retinal hemorrhages are usually seen at 85% in infants who are shipped. So how do we diagnose? We suspect abuse with histories that is not keeping with the physical finding, especially at the child's developmental stage. You can do your bone survey, you can do your bleeding parameters, your PP and PTT to rule out bleeding diastasis. You can do your head or abdominal CT scan or MRI. So how we treat? First, give the appropriate medical, surgical, and psychiatric treatment. Okay. Then the children should not be given back to the abusive parents or caregivers. They should not be discharged from the clinic or office without consulting the child protection service or unit. Hospital admissions, when do we admit patients of abuse? When medical or surgical conditions require inpatient management, and in whom diagnosis is not clear and when there's no alternative safe place for the child. So you can admit the child. Then sexual abuse. So sexual abuse includes any activity with the child before the age of legal consent, that is for sexual gratification of an adult or significantly older child. The most common type would be sexual abuse by a family member. This is termed as incest, or non-relatives known to the abuser. Okay? The least common offender would be a stranger. Intrafamilial sexual abuse is difficult to document and manage because the child must be protected from additional abuse and coercion, and not to reveal or deny the abuse to preserve family unity. Then, we proceed now to the ethics in pediatric care. We'll be talking about autonomy, which means this is the central principle in ethics. The purpose is to allow competent patients to make their own healthcare decisions based on their values. That is autonomy. Followed by the competence, that's a settled issue, is the patient's ability to understand the possible consequences of his or her decision and the available alternatives. That is competence. Next would be beneficence. Beneficence simply means is to avoid harm as well as to advance the welfare of others. That is beneficence. And paternalism is that interfering with the liberty of another person for his or her own benefit. This view provides justification for many intrusions for the benefit of children over their apparent objections. So even the child objects, you have to, like surgery if it's really needed, and immunizations. Most children will hate immunizations because they hate needles being stick, but still, as parents or as caregiver, we subject them because it will be more beneficial to them. Okay. Truth telling, the duty to tell the truth, is a requisite for any moral community. Important in physician-patient relationship because trust is essential. And confidentiality. Okay. The patients need to trust their doctors, not to disclose private information to others because this facilitates full disclosure of information relevant for providing effective personal health care, preventing disorders that threaten others in the conflict of interest or COI, pediatrician versus parents or guardians. Sometimes there will be situations that the pediatrician and the guardians may not agree. Okay. Example would be withholding and withdrawing life support. Okay. Most important ethical dilemmas that doctors face: withdrawing and withholding life support. Issue arise most commonly in the newborn period. Okay. Most pediatric patients are clearly not competent to make their own decisions with regard to termination of care. Okay, the ideal observer theory, it says that characteristic of a morally acceptable decision. Okay. Omniscience is a decision that has included all the readily available and relevant facts. Omnipercipience, the decision has empathically taken into account the feeling of those involved. Disinterest, decision is not based on vested interests. Dispassion, decision is not made under conditions in which a strong emotion obscures critical thinking. And consistency, the hallmark of ethical reasoning, meaning that similar cases are decided similarly. Now the issue on withholding versus withdrawing treatment. Actually, there is no moral distinction between the two. So how do we justify withdrawing treatment? Withdrawal of treatment has the benefit of coming after a clinical trial, resulting in more data about the likely outcome if treatment has been withheld. The traditional prohibition of withdrawing treatment led some doctors to withhold treatment from some infants who had reasonable prospect of benefit, like your example would be a very small premature will be allowed to die in delivery room. Then euthanasia. Okay, that's another problem. Another challenge would be because euthanasia, in the strictest sense, is just means killing someone. So it should be important to differentiate euthanasia from just allowing a patient to die. So because in principle, we should relieve suffering of a patient and not to kill, even when without the procedure the patient would die a natural death. Okay? Okay, that is the principle. So we differentiate that there are two types of euthanasia, your active and your passive. So your active euthanasia is generally being opposed due to the concerns for the interest of the patient. Though there will be more opportunity to minimize suffering. While passive euthanasia is to allow a patient to die of some intrinsic disease or defect without medical intervention. That's passive euthanasia. Then the issues on research. Okay, in research, children should, along with other non-consenting subjects, should never be used in non-therapeutic research. For the Hospital Ethics Committee, they have the consultative role in cases which parents and medical staff cannot agree on a proper course of action. So that's where we implore the help of the Medical Ethics Committee, because Medical Ethics Committee is recognized as an important decision-making body. Okay. And that ends my lecture. Hopefully you enjoyed it. Again, maraming salamat po. And please visit my channel, Benjamin Cabrera. Please click the subscribe button and the notification bell. And please share this video for others may learn. Thank you very much.